Hi, this is Dr. Claybrooks, and this is Real Medicine. Shedeur Sanders has sustained an oblique injury, and we need to talk about what that means for his season and his future from an orthopedic surgeon's perspective. Let's get into it. Well, I am a football fan outside of being an orthopedic surgeon, and originally I'm from Detroit, even though I live and I practice currently in Orlando, Florida. And because I'm from Detroit, that means I root for the Detroit Lions as my primary team. But as an NFL fan, I'm interested in many players around the league. And this young man seems to have a bright future, but he's recently been injured, and we would like to talk about how this may impact him going forward in the preseason and potentially in the season to come. So if you don't know who Shedeur Sanders is, he was drafted by the Cleveland Browns in his most recent NFL draft. He played the past 2 seasons for the Colorado Buffaloes under his Hall of Fame and legendary father, Deion Sanders. And if you're not familiar with Deion Sanders' career, go to YouTube. You'll see some amazing highlights and plays. Deion Sanders played cornerback. He at times played wide receiver. He ran back kicks, ran back punts. He was electrifying. And he actually played baseball as well. The man was an incredible athlete. But we're here to talk about his son, Shedeur Sanders, who looks like he could have a very promising career in the NFL, considering how he played last week. But he may be sidelined and derailed a little bit for the future. So let's get into that right now. So Shedeur Sanders is a quarterback, but he recently has an abdominal oblique injury. But I want to talk about first the difference between a ligament and a musculotendinous unit, or MTU. This will give you a little bit of context about what we're discussing here. So we often hear about ligament injuries. I think one of the most common ligament injuries that we may hear, if you're a sports fan, is the ACL or the anterior cruciate ligament injury. The ACL is a very powerful ligament inside of the knee, very important for when you plant your foot, it provides stability to the athlete. So if you don't have a strong ACL or you tear your ACL, that can be a problem for an athlete. So a ligament is a structure that attaches 2 bones together. So in layman's terms, the ACL would attach the thigh bone with the shin bone. Well, technically it's the femur, which is your thigh bone, and the shin bone is what we call the tibia. But you get the point. So a ligament, again, attaches 2 bones. There's no muscle involved in a ligament, okay? So now let's contrast that with an MTU, or musculotendinous unit. Muscles are what allow us to move our extremities, our hands, and moves joints. But a muscle attaches to the bone by a tendon. And so if that tendon is disrupted, it can be a problem. And that's what we talk about when we discuss the musculotendinous unit. The muscle attaches to the tendon, and the tendon attaches to the bone. Now, the reason that works, as you can see in this diagram, it functions in what we can call an anatomical pulley. So let's use the thigh muscles as an example, what we would call the quadriceps muscles. At the end of the quadriceps muscle is the quadricep tendon, the MTU, musculotendinous unit. At the end of that quadriceps tendon is the kneecap, or the actual patella bone. On the other end of the patella bone is the patella tendon, which then connects to the shin bone or the tibia. When you contract your quadriceps, that's what allows you to pull your knee up, or if you wanted to kick someone. Not speaking about violence, but it's a real thing. So it functions in a pulley type of fashion. So that's how the MTU functions. So let's get back to Shedeur's injury. They're describing his injury as a strain. And I want to make another distinction. There's a distinction between a strain with a T and a sprain with a P. So a strain, S-T-R-A-I-N, is stretching or tearing of the MTU. That's different than a sprain, S-P-R-A-I-N. That only refers to ligaments and does not involve a muscle. So you can sprain a ligament, but you can strain an MTU. Okay, so Shedeur, has a strain with a T. Now, strains are classified, and they are classified as grade 1, grade 2, or grade 3, or some will say 1st degree, 2nd degree, 3rd degree. So a 1st degree strain is minimal stretching of the MTU, just minimal stretching. But you know, if you stretch something further than it wants to go, that can be very painful, okay? Grade 2 or second degree classification would be partial tearing of the MTU. So now we've gone beyond just stretching it and actually some partial tearing of it. A grade 3 would be a complete disruption, which would be the most severe of the 3 in the classification. If you have a grade 3, you may experience some swelling, you may experience some bleeding, and you can also have obviously local discomfort. And you can see on this particular diagram here, you can see the portion of the tendon being separated from its attachment to the muscle. You can imagine how painful that could be and how it could limit your function and your ability to perform your job if you're a professional athlete. Now, how do you treat it? Well, you treat a strain with ice application, immobilization, and rehabilitation. So what does ice do? The reason you put ice on an acute injury is because it helps keep the swelling down. It's a very, very good way to minimize the inflammation and keep the swelling down, which is helpful. Immobilization, well, if you injure something and you just keep aggravating it, you can just keep stirring up the discomfort, keep stirring up the swelling, and that's not good. So you want to immobilize these types of things. And then rehab, you rest it, you allow yourself to recover, but we know that when we do that for an extended period of time, muscles tend to get weak and they need to be rehabbed. Now, very rarely surgery can be required if there's a complete disruption. You need to reattach the structures that have been disrupted. So that's a very, very rare case. Now, let's talk about the anterior abdominal wall, because that's where the oblique is actually located. So your anterior abdominal wall, as you can see in these two diagrams here, are located basically from the base of your rib cage all the way down to your pelvis or your iliac bones, and we'll get into that shortly. Your anterior abdominal wall is made up of layers of muscles, and you actually have two oblique muscles. You have the interior oblique, and you have internal oblique or interior oblique, and you have an external oblique. They're called oblique muscles because they are roughly at oblique angles from each other. Not exactly 45 degrees, but roughly at oblique angles. So that's the reason that these muscles are called the obliques. And as you can see in this diagram, the oblique muscles, again, they attach from the base of the rib cage going down to the top of the pelvis or the iliac bones. In this particular picture, you can see a diagram of a pelvis, and what some would say my hip bones, in layman's terms, are the top of what we call the iliac crest. Your pelvis is made up of 3 bones. You have a iliac bone, one on the left and one on the right, and in the middle they wedge together to meet the sacrum. So this is what we call a keystone joint, where the sacrum and the ilium meet. But specifically for the purposes of this talk, if you look at the top of these bones, you'll see where it's labeled the iliac crest. Well, that's where those oblique muscles attach. So the function of the oblique muscles, they help us flex, okay? They help us rotate, and they help tense up the abdomen. So as you can see in this video, the function of the oblique is very, very important when you can see the motions that a quarterback has to go through to deliver the ball to his receiver. And now you can understand how if you damage or disrupt an oblique muscle, first of all, how painful it could be, but also how it can make your job much more difficult when trying to deliver a pass, because you need those muscles to have a very powerful delivery of the ball. So what does this mean for Shedeur? Well, it really depends on the extent of the injury, which will let us know how much time we expect Shedeur to be out. As an orthopedic surgeon, I expect Shedeur to make a complete and full recovery. An MRI will be very helpful to determine the extent of the injury, because that will allow us to see how much damage actually occurred. At the time of this recording, there's no reports that I've seen that an MRI has been done, and I'm an orthopedic surgeon. I'm not his orthopedic surgeon, so I don't have his medical records, and I don't know if an MRI has been completed at this particular time. But in conclusion, I think Shedeur will do well. I really want to know what you guys think. I have 2 questions that I'd like you guys to respond to in the comments. Do you think Shedeur will have a good season? And do you think the Browns will make the playoffs? Now, I'm a Lions fan. I'm from Detroit. But I'm rooting for Shedeur and I'm rooting for the Browns. We're in the NFC. They are in the AFC. So it doesn't affect us at all if those guys make it to the playoffs. And it will be very exciting for the NFL. So this is Dr. Clay Brooks with Real Medicine. Please like, please share, please subscribe. Thank you for tuning in. Bye-bye.